Hello, I'm Srilata, Chief Dietitian, Medicover Hospitals, Madhapur. Today I'm going to talk about glycemic index of food and how can you make any food low in glycemic index. The glycemic index comes into picture for especially diabetic patients. So their body will not be able to have enough amount of insulin. So they need to restrict carbohydrates in their diet. If they take too much of simple carbohydrates, the requirement of insulin goes high. So glycemic index is something that any food which is having carbohydrate, when you consume them, the level of glucose which increases in the body is something called as glycemic index. So it has three types of glycemic index. One is low glycemic, medium glycemic and high glycemic. So a number which is less than 55 is low, 55 to 69 it is medium, above 70 is your high glycemic index. So all we need to understand that people who are dependent upon the rice or high carbohydrate diet will have high glycemic food in their diet. So especially when we see South people, they have too much of rice items or rice preparations through the year. Like if you see that is there is pulhora or khichdi or pongal or daddojanam, or they have parmanam, then they have jantikalu. All these are rice based preparations, or they can eat biryani or anything like that. If they prepare some kheer or paisam, it is again rice based. So white rice is very high in glycemic index. The same rice, if you consider basmati, it is medium glycemic index. If it is brown rice, also medium glycemic index. When you take millets, they are also again medium in glycemic index. Vegetables which have very less carbohydrates are low in glycemic index. So ideally a diabetic should take 3 meals vegetables as salad or vegetable preparations or chutneys or dals or raitas. This is what each meal, if you have good amounts of vegetables, green leafy vegetables or salad vegetables, then the glycemic index of that particular meal will go down. Simply when we are taking idlis, which is prepared out of rice and urad dal or black grape dal, instead of white rice, we can try using millets or brown rice. Then instead of this split black gram dal, we can use whole black grams, and instead of any other chutneys, we can have some green leafy chutney like mint, coriander or curry leaves chutney, or you can have any vegetable preparations. So if you could prepare such thing, then definitely the glycemic index of idli comes down. When it comes to lunch, if you are taking white rice along with sambar and some buttermilk or curd, the glycemic index of the meal is very high. If you replace that white rice with brown rice or basmati rice plain, not biryani, or a millet rice, and then instead of that sambar, you can take sambar along with lots of vegetables, like it could be onion, tomato, carrot, beans, brinjal, a mixed vegetable sambar, or a leafy dal, or a rajma chola curry, along with 2 cups of veg curry and 1 cup of a vegetable salad, which can be a cucumber, tomato, onion, carrot, beetroot, a big serve of it, and a bowl of soup with a glass of thin buttermilk. And all we need to understand is the amount of carbohydrate really matters. The portion control. Let's say if the rice is around 60 grams or this much or 45 grams, the other food groups should be in larger amounts. Altogether there can be up to 650 or 750 grams because they hardly give us any calories. The time we digest them, most of the calories are burnt. So if you take a big cup of sambar along with vegetables, 1 big bowl of vegetable salad, 2 cups of vegetable curry, 1 glass of buttermilk and little of brown rice, then automatically you are reducing the glycemic index of that particular meal. Likewise for your evening snack, if you are taking poha, chuda, muri or anything like that, your glycemic index is very high. The same thing if you can take sprouts or boiled grams, if you can take a ragi malt with buttermilk, or you have a vegetable soup, or you can have some puffed chana or roasted peanuts, then the glycemic index is very low. Likewise for dinner, instead of white rice, you can have jowar, bajra, ragi or any sort of millets or whole grains roti. Even barley roti also can be prepared, along with a big katori of salad, a vegetable preparations of 2 cups, dal or any whole grain dal 1 cup, and a glass of buttermilk or a cup of curd will again lower your GI. So if you could understand the significance of green leafy vegetables, then your diet planning will become very easy. Fruits again are classified into low, medium, high. The fruits which are very sour to bland will have low glycemic index. It can be your lemon, it can be your amla, it can be your orange or mosambi, which is sour variety. The sweet variety, the genetically modified varieties like your papayas, watermelons will have high glycemic index. The countryside variety will have low to medium glycemic index, like your strawberries or mandarins or passion fruits. These have low glycemic to moderate glycemic index. So cherries and all these also medium glycemic index. So when you take certain fruits which are really sweet, like your chiku or sapota, then your custard apple and sitafal, jackfruit, your green grapes, they will be high in glycemic index. So we need to understand that the American Heart Association, American Diabetic Association has given that low glycemic index is easy to go, medium glycemic index we have to take in moderate amounts, and high glycemic index we need to think either take or not to take. So if you could adjust these meal portions according to the glycemic index, we can easily make the meal into low GI. All we need to understand is the glycemic load and glycemic index. This can happen only by a qualified dietitian. So please approach them and get a stipulated format for a diabetic patient to have a healthy low GI meal. When you add fat like butter, ghee or oil to diet, then also your glycemic index goes down. It doesn't mean that we have to add loads of the fat into diet, but occasionally when you want to take, the glycemic index can be reduced in this way. Thank you.